Medications for opioid use disorders in correctional settings. Shifting the paradigm, creating a balanced correctional and rehabilitative approach. The Opioid Response Network is funded by SAMHSA to provide resources and technical assistance needed locally to address the opioid crisis. This video is part of a series to provide guidance on the implementation of medications for opioid use disorder in correctional facilities. Leading corrections and behavioral health experts present information on topics such as the use of medication, models of delivery, diversion, and linkages to care and community support. Brent Gibson welcomes state officials and other dignitaries.
Morning, everyone. How are you doing today? Good. Let's see. I first want to say thank you to everyone that's invited me to be here with the ORN, with the Academy of Addiction Psychiatrists, and so many other people. It would take all of the 10 minutes I have to list everyone. So if I have left anyone off, I apologize. We do have a couple of our board members here. I want to recognize Peter Ober, who's on his phone over there. Hi, Peter. Good morning. Representing the Association of Physician Assistants, and we may have Dr. Penels and Pauline Markison also here. If I haven't said hello, I want to do that now. But thanks for allowing me a few minutes. I feel like the odd person out with these two very important women to my left, but it's a privilege to be here and tell you a little bit about NCCHC and what we do and why we're here and why we care. So first things first, I had some great conversations this morning with people who are in the field working with these patients directly. And I just want to say it's so important what you're doing. You're not alone. You're here gathered, but once you leave here, you're going to feel alone again. You're going to feel like you're trying to solve these very challenging law enforcement, clinical, and administrative problems by yourself, but you're not. And what you're doing does make a big difference. You are, in many cases, the only voice these patients have and the only technically competent people that can get people back on track and put their lives back together. And as we know, this is not a problem that the heroin addiction was when I was growing up, the back alley and the addict that nobody wanted to deal with. This is an everyday problem with people from all walks of life ending up opioid addicted and often ending up in our nation's jails and prisons. So a couple of takeaways, I'm going to show these now and then again later, and please know that we do have a workshop later tomorrow afternoon where we're going to touch on some of these things here. This may seem obvious to this group, but I can assure you, working all across the country, none of these points should be taken for granted, especially not all three together. This is a treatable chronic disease of the brain, as we know. It's very well studied. I'll talk a little bit in the workshop about how we want to be careful with comparisons with chronic disease in general, because you'll get pushback from some circles. I have been told many times, don't tell me it's diabetes, doc. It's not. It's something else, and that's true. But the framework of chronic disease is very helpful. Treatments need to be individualized, which is the opposite of how we do corrections. I come from a military background. Individual anything is not really encouraged. And the same is true from corrections, a very paramilitary environment. But that's not what we do in healthcare. Treatments are individualized, and they need to be for our patients as well. Correctional programs are a reasonable and rational place to begin and maintain treatment. I would tone that down. That's toned down a little bit. I would say it's probably closer to it's an imperative. If we don't have some kind of treatment, something going on for the correctional population, we're doing a public health disservice. I want to talk a little bit about who we are. May I just have a quick show of hands, people that have heard of NCCHC? Oh, I love it. Fantastic. Well, this slide you can just sort of file, but we are really a group of 4 501c3 not-for-profits based out of Chicago that have been working in the correctional healthcare space for 4 decades, really since the late 1970s. And we have broad representation across healthcare, law enforcement, business, and other groups that allow us to provide the closest thing that we have to a national we do write the national standards, but we are the only organization that looks nationally to bring the level of care up to something recognizable as high-quality healthcare. Who we are very briefly: 500 correctional facilities coast to coast. That really gives us a very unique perspective when we have many thousands of individual people that are also certified. And one of our newest things that we do, not unlike some of the activities of the ORN, is we provide consulting services nationwide. All kinds of things people ask us to do. Some we can do and some we can't. But one of the reasons I wanted to for sure come here today was to let you know that we can assist with many of the technical areas with MOUD implementation. Where did we come from on this? We were one of the original recipients of the SAMHSA grant to get methadone treatment in jails. And to this day, we are the only group that writes standards that lead to accreditation for a methadone program, if you will, housed in the jail. There are all kinds of other ways to do it, but if you want to stand up methadone inside your jail and you want to do it yourself, in other words, without a community provider, our standards are it. The challenge is those standards were written for methadone clinics probably 10 to 20 years ago, and so they may not be directly applicable to your situation, which is why we are actively revising those standards, and you should look for them soon. I have just a few minutes left. Good, so I'll be quick here. Why do we care so much about this? Because, to state the obvious, it's a major source of morbidity and mortality nationwide. But probably also very important is because it's such a big problem and so much money has been thrown at it and so many people are active, the landscape is at best irregular and a little inconsistent in terms of what people are doing. Now, it's not that we can have a one-size-fits-all program, but we can probably do a little better than this jail having only Vivitrol, that jail having only methadone, that jail only having buprenorphine, et cetera, et cetera. And by the way, this jail, the closest methadone clinic is a 3-hour drive. Well, that's not going to work. So those are some of the challenges with kind of hit and miss approaches to the problem. And we want this to be a national solution, and that's where we see ourselves fitting in. And many, many people turn to us as well. A couple of quick publications, and then I'll give the rest of my time. A few things to look at your leisure. This is an older publication, but it helps lay the groundwork. It's kind of like 101 stuff. This is a publication with the National Sheriff's Association. I would say that its value is in part the technical information, although it's now itself getting a little dated, but it was done in partnership with the nation's sheriffs, which is very important. And finally, you've all seen this from the what used to be the Institute of Medicine, which has some key things in it. Here's the takeaways again, and that is really all my comments, and I'll be here all week, and here's how to find us. Thank you very much.
Technical assistance is available to support the evidence-based prevention, treatment, and recovery of opioid use disorder. To request technical assistance, visit opioidresponsenetwork.org.